The Department of Health is expected to brief the media later today in preparation for the country's second phase of COVID-19 vaccinations tomorrow. Health Minister Mkhize, along with the health MECs, will be detailing the rollout strategy. Professor Francois Venter, head of research group Ezintsha at Wits University, joins me now to discuss this and look at the lessons learned during the first phase. Thanks for joining me this afternoon. What are you expecting tomorrow when the rollout begins, Francois?
I hope lots of details as to where people are going to present themselves, and the specifics. Where, if you've got a 62-year-old mother who needs a vaccine, where do you send them and when? And those are the kind of things we need to be asking. It really worries me that I think government has underestimated how big a job this is going to be. We haven't had anything in the healthcare system this large since the antiretroviral program, and we kind of tried to do what we did with the antiretroviral program, which was a huge endeavor, in just the space of a few months.
You know, that's music to my ears, what you said about getting the detail right, because that's really what's been missing for so many of us South Africans. But how was the first phase managed? Do you think that anything could have been done differently?
Look, I've been a critic. I think that there's been a lot of goodwill. I think people have intended things well, but I think there's been a total lack of transparency, and particularly bad amounts of, I think communication has been really bad. And often for reasons that are not clear to me. There's no political gain for this poor communication. There's no scientific gain, no public health gain. It's just been bad communication. And I think people are steadily becoming more frustrated. You know, we've been told these vaccines are coming, they're coming, and then they're hiccups. The other thing I'm critical about is I do worry that we've invested in way too many options. You know, we've got a handful of vaccines available to us, and we keep saying, oh, we're not going to use this one. And then when the others break down, as we've seen with the J&J vaccine, we kind of left stranded, which has led to a really terrible situation, which is we're the second from the bottom of the log in Africa in terms of number of people or percentage of the population that has been vaccinated.
So clearly a strategic error selling our stock of AstraZeneca. That's what you would say, right?
Absolutely. I think that was the first misstep. I think there have been other missteps. I think prior to that was just coming so late to the party, you know, and putting all our faith in the COVAX
Sorry
facility.
to interrupt, Francois, but why do we do that? Don't we keep hearing that we always follow the science? We're following the scientists, the medical experts. How come we got rid of AstraZeneca if it wasn't because the medical scientists were saying it's not effective enough?
It certainly wasn't me, and it certainly wasn't any of the other major respiratory virus scientists who thought that was a good idea. It's unclear who actually made these recommendations, just as it's unclear who made the cigarette recommendations or the alcohol recommendations or many of the so-called following the science recommendations. And it's this lack of transparency that I think is so frustrating. Because government says we're following the science, but they won't say who.
Would you be bold enough to say it's incompetence?
Look, it certainly is of huge concern. We spend more money per capita on our health system than anybody else in Africa, and to be second from the bottom of the log is horrifying. I do worry that there's political sort of agendas at play here, particularly around the alcohol and the tobacco industry. I think there's power plays that are going on, and you know, it's going to be measured in lives. We already into what looks like the early stages of the third wave, with not a single South African vaccinated in the state or the private healthcare system. All the people who were vaccinated, all 400,000 people, were healthcare workers vaccinated in the research program. And even then, it's only a third of the healthcare workers. As I said, not a single South African outside of that.
I'm glad that you mentioned the coming third wave. When we look at what happened in India, it was just like us, phased, first the older people, etc. And then when this hit, and they couldn't control it, all of that went out the window, and they said vaccinate anyone and everyone as quickly as you can. Do you think we're going to end up in a situation like that?
I do. So I was very involved in the antiretroviral program in 2004, 2005 onwards. And one of the things that happened with government and to the extent with the researchers was this desire to micromanage and control the program. You have to strip away all the bureaucracies. I think those visions are from the United States of people going through drive-thrus, sticking their shoulders out the window to get the jab. That's what we should be thinking about, is how do we get to the taxi ranks? Where do we get to the shopping malls? Where are people congregating in large numbers? And make it as easy as possible to get the vaccine. These ponderous online systems, they well-intentioned, but I think that the people involved in them don't understand quite how big a job this is going to be to vaccinate all 40, 50 million South Africans in the next couple of months. And that's left us already behind in terms of the healthcare worker program, let alone the general South African public.
Western Cape Health MEC said just yesterday or the day before that the system could collapse if we hurry up with this. And all of us want us to hurry up with this. Why? Why, with all the time we've had to plan, is there still a conversation about the system collapsing if we move too quickly?
I'm not quite sure what he means by the system collapsing. I think that with the right focus and with the right mobilization of everybody, I think it's possible to do this, to be honest, with my experience from the HIV world. But it does need government to understand, and the private sector, and every single person in the country to understand they have to get behind this. It is possibly the biggest ask in terms of service delivery we've ever had in the. We've only got, every day that we delay means more and more people are going to die if we don't roll out the vaccine. It takes a couple of weeks for the vaccine to actually become effective. So if we are at the start of the third wave, and it looks very likely we are, it's unlikely we're going to get any protection from the current wave of vaccines in that process because, we've seen in the second wave, it's over within just 2 or 3 weeks. So, and that's the minimum amount of time it takes for the vaccines to work. So we really need to get cracking and with the urgency this epidemic deserves.
I like your urgency. Let's hope we can get that done. Professor Francois Venter, Head of Research Group Ezintsha at Wits University.